Hey everyone, I hope you are surviving this summer heat okay. I know here today it was 99 degrees and the heat index is much higher. I know in a lot of places it's much hotter than that. So I hope you're doing well. I wanted to talk today about why I stopped drinking alcohol for now and why I'm off birth control. And just to be clear, I am not pregnant. I learned something recently from a close family member that if you're new to me, new to my channel, just a little context, I have a tentative periodic paralysis diagnosis, and I suspect that it might be the Andersen-Tawil subtype. And I think that based on cardiac events that we've had in my family, physical traits, and the symptoms that my family and I experience. I experience episodic muscle weakness. You can check out other videos that I've posted if you want to learn more about that. But I recently had the chance to meet with an immediate family member who experienced cardiac arrest and a stroke. And that is in part why I think Andersen-Tawil syndrome might be a possibility. But as I've been researching, as I've been exploring the possibility of this diagnosis, as I've been gathering family history, this family member started doing research as well and looking into Andersen-Tawil syndrome out of interest, and learned that people had died from cardiac events after having like a single glass of alcohol. And I've heard of people in the support groups that I'm in have experienced really extreme symptoms as a result of having alcohol, and not even a lot of alcohol, just like a single drink. And I personally am not a big drinker. My body just doesn't feel great with alcohol. I can have a single glass of wine, and I think partly because my tolerance is so low and I'm a bit of a lightweight. I don't have much body mass, but it just does not feel great to me, and that's something that's pretty consistent in my immediate family. We just don't feel great with alcohol. And so I think the fact that, we don't feel great with it, so we don't drink much, and then low tolerance, and like that just kind of feeds into each other. And I have found that for me, like for example, when I was on my honeymoon, I had a large bowl of either pho or ramen for lunch, which was very salty and very carby, but oh so gloriously delicious. And then we went to dinner, had a nice dinner. I had like little crab cakes with a glass of wine for dinner, and I remember that I had extreme muscle weakness after that, and I wasn't drunk. It was just, I probably looked drunk, but I've just had that experience with alcohol before. There was another occasion where we had gone to see my husband's family, and I believe I was eating gluten-free at the time and was super, super excited because the restaurant we were going to served gluten-free fries. And so I just went all out, and I had all of these fries, which was also a lot of salt and a lot of carbs. And I haven't had issues too much with fries in the past, I think because typically the fat kind of balances out like the blood sugar reaction. But I also had a glass of wine later that night, and I woke up in the middle of the night feeling like I was having a panic attack. And it was a really terrible feeling. So whether or not that was an actual panic attack or I was having a heart issue is really scary. But anyways, I say that for context. What I learned from this family member recently is that when they were looking into the research about Andersen-Tawil syndrome, they remembered that the night before their cardiac arrest, they had had a single beer. And this is one of the family members that doesn't feel too great with alcohol, usually. And so this person also does not drink a lot of alcohol. And so, there's that question of like, well, maybe the alcohol was part of that. And based on what I've heard in support groups about people having issues with alcohol, that makes me really, trepidatious about drinking it, So, but I want to say that, and I want to like empathize with anybody who's kind of been in similar situations where like you don't really have a concrete answer. Like I've had times where I've had alcohol and I've been fine, and I might be more prone to getting tipsy than another person just because I don't drink often and I'm small and petite and I don't have much body mass, but I still like an occasional glass of wine. I like to enjoy a glass of wine with friends. I would say on average I have less than one glass of wine a month. So it's not very often that I drink at all. And so, but like the idea of, like I've already had to kind of tailor my diet based on the symptoms that I experience, and I've had to be like what some people would consider somewhat extreme, like going more low carb, and being really careful that like when I splurge, I'm making sure that I am having potassium, that I'm making sure that I'm okay, and that I'm looking out for triggers that could potentially like maybe even affect my heart. And so I don't know, like maybe other people might relate to this, but I get tired of like what I can't do with these illnesses, what I can't get away with. Like it just feels a little unfair sometimes, and I just want to say that, to express it for anybody else out there who's experiencing the same frustration, because it's really frustrating. Like I don't like the idea of not having a glass of wine for the rest of my life. I'm like 35. That's hopefully a long way to go. But it's just really hard. I just feel like there's this great sense of deprivation. You know what I'm saying? Like I'm already having to do all these things, and that's just one more thing, and so I know nobody's guaranteed these things in life, like nobody's entitled to these things, but it's just really frustrating. And the fact that I don't even have a clear answer, that's not, like I haven't even asked my doctors about whether or not alcohol is okay, because, like they can't really say. They're not gonna be able to have an answer for that. And the fact that I can't have really a concrete answer just makes it like, I don't know if it makes it better or worse. Because like on one hand, like if it was a definite like can't have it, I kind of wonder if I would want it more, but at the same time, because like of that uncertainty, it's almost like I want to kind of like push the boundaries because I don't want to feel so deprived, So I don't know. Those are just my thoughts lately. I don't know if that made sense, but I find myself like wanting to go to the opposite extreme, and not in the sense of like getting drunk. I've never really had the desire to get drunk, just because like of how alcohol affects me, but like in other areas, like where I want to like have a crap ton of carbs or have like a really sugary thing. And I have splurged. Like I went out with my husband and I went out with some friends, and I split a huge slice of cake with one of our friends and ate it the next day as well for like part of my breakfast along with my normal breakfast, and felt terrible after that other piece. But not recommended. But like it's just like sometimes it's hard because I feel like people without these health conditions can get away with cheats or treats, however you want to say it, like easier. You know what I'm saying? And it's just, it's a lot. So I'm venting a little bit. Hopefully this is something that's relatable for you guys, but I just wanted to put that out there. So in case you're also feeling deprived, I am right there with you. The other thing I wanted to talk about is I decided within the past couple of weeks to go off my birth control, and that was actually not anticipated at all, much like the alcohol thing. And the reason that I decided to go off my birth control, it's the progestin-only pill. Oh, it's called norethindrone is the generic term, and I think like the brand names are Aaron and Heather. So interesting that they're naming them like names, but I was specifically prescribed the progestin-only pills because I can't have anything with estrogen because I have migraines and I've had 2 blood clots. So that's a very high risk for having the estrogen. That can cause like more blood clots and like stroke, I think, for migraine folks. But so anyways, I'm somewhat already limited in my birth control options. And my doctors had suggested, I've seen 2 gynecologists and both have suggested IUDs, and I've just always been like really hesitant because like I've heard so many horror stories, and like having hypermobility and like muscle weakness, like in my mind I'm just like, what if it just like falls out, or what if it like perforates? I've heard stories about like perforation. I've heard a lot of like negative things, and that's from people that have gotten them that are like not healthcare professionals. And I also have like another friend that is a healthcare professional that also is like not particularly fond of IUDs. And so like I've just been hesitant to go down that road, but I stopped the progestin pills that I was taking, because I learned recently from another family member that they had experienced their strokes due to AFib. And what I didn't know is that Andersen-Tawil Syndrome can actually have AFib as well. And I just had kind of like a moment. I had been talking with somebody in one of my support groups and talking to somebody who has like over 20 years of experience in the periodic paralysis community. And so he's seen a lot of presentations of periodic paralysis, and especially like the cardiac manifestations that can happen in Andersen-Tawil syndrome. And he had mentioned AFib, and I didn't remember seeing that in any of the research I had done. I had seen ventricular ectopies, I'm not sure if I'm saying that right, and long QT, but what I didn't understand is that long QT can actually cause AFib. And so I did a little bit more digging, and I've had some strange reactions to certain medications, like Toradol, for example. I was given IV administration of Toradol when I was in the ER once because I was having what I was told was considered chest wall pain. I was having like those kind of cramps and like shortness of breath that I get like when it gets really hot out. I've been experiencing it today a little bit. And so they gave me that, but when they administered it, I had such intense chest pain. It was really scary. And the nurse that was there was like, yeah, that happens for some people. And I was just like, how can that be normal? Like, you know? And I had another experience with a prescription called Zofran. I think the generic term is like Odanzatron, something like that. And it's hard to describe the sensation that I felt. Like I was kind of like dizzy, and I just felt like off, like something was not right. Like I would kind of describe it similar to the feeling of having low blood pressure, but I was like kind of putting all of this together, and the fact that our family may have Andersen-Tawil syndrome. I read up some more on birth control and on norethindrone, and found out that it can actually exacerbate long QT. And so just because like long QT can be exacerbated by a lot of medications, and because I've had those strange reactions to medications, I was kind of like reevaluating in light of the recent knowledge that yes, a periodic paralysis specialist thinks that we could be experiencing periodic paralysis. My kind of take on it possibly being Andersen-Tawil syndrome, and then the implications of that, like the possible long QT involvement and heart involvement, and what that means as far as medications, because that really, you have to really be careful if you have long QT syndrome, because there's a lot of medications out there that can trigger or make it worse. So I did not want to risk having a cardiac event because of having birth control. So I did reach out to the periodic paralysis specialist just to get her take on it. And I said, listen, like I noticed that, in my family, we have a lot of cardiac events. I'm thinking that this could be the Andersen-Tawil syndrome subtype. And I noticed that I've had strange reactions to medications. We've had cardiac events in my family. I've had like strange cardiac happenings. Like I have sinus tachycardia, and I've just had weird reactions in general to medications, to alcohol, that kind of thing. So I didn't want to risk that. And so I wanted to see if she either had any thoughts or an opinion on whether it would be whether it would make sense essentially to get off the birth control. And I think her response was completely reasonable. She said, it's a really specific question, and it's hard to say because we don't have like the answers. She said, but if you feel safer going off the birth control, you can come off of it and then ask your OBGYN about alternatives. So that's my plan. That's what I'm going to do. And I think that might land me, as far as birth control alternatives go, it might land me in like the copper IUD realm, because that one doesn't have any hormones at all. Not very excited about that, to be honest with you. I've been watching videos and reading up on other people's reviews a little bit. And I have heard some like positives, so that gives me a little ray of hope. I'm just, I know that everybody's different, and I'm curious and nervous about how my pain tolerance might be, especially I think because one of the medications used to help numb during the procedure of like inserting the IUD, maybe lidocaine, and I've lacked sensitivity to proparacaine. People with Andersen-Tawil are known to lack sensitivity to lidocaine. So I don't know. I'm really gonna have to talk this through with my OBGYN to see what we can do and what the options are. So I don't know, but I don't know. It's just been really hard. I had like a day where I was just like over it and like not wanting to have to deal with all of these like specific, intricate, nuancy things, because like honestly it just gets so complex, and like it's just a lot to have to think about and to keep track of, and to be able to articulate like the concerns to doctors who don't know about these conditions. It's really hard. But the thing that like I found really encouraging is that I've had a lot of doctors who are willing to learn about periodic paralysis, and they are very open to what I'm saying, and they do show concern. So that's where I've been encouraged. Excuse me. And anyways, I just wanted to catch you guys up on that area of my life. If you have similar experiences where it's, you know, whether related to not being able to have certain drinks or foods, or where you've had birth control issues, if you have experience with a copper IUD, I'd be super interested to hear about that, especially if you have Ehlers-Danlos syndrome or periodic paralysis, and or if you've just like been in that situation of like not knowing, like where the doctors can't really give a yes or no, so you kind of have to like decide for yourself what you're gonna do, and like what was that experience like for you? Because like to me it's kind of like empowering in a certain way, because it's like, okay, like I'm taking charge of my health, but at the same time it kind of feels like, ugh, like I don't want to do this, because I really want to have a glass of wine every now and then. Like I want to have my piece of cake and not have to worry about like my body going into an attack of muscle weakness like afterwards, and looking like I'm drunk and having to explain to people what's going on. It just like, it's like a cascade of things, you know? So anyways, let me know what you think. I would be delighted to hear your thoughts. I know like I'm in a weird kind of tone right now, but I really do want to hear your thoughts and your experience. So if you would like to hear more of these kind of anecdotes, if you are interested in learning more about periodic paralysis or my experience with Ehlers-Danlos syndrome, like, subscribe, and I have more videos forthcoming. I will see you guys soon.